My name is Coral Cohen. I am from United Way of Broward County's Commission on Behavioral Health and Drug Prevention, and specifically, I'm the liaison to our Mental Health Promotion Action Team, which is the group that is putting on this event for all of you here today. We are so glad to have you all here. There's so many of you on here, and I know that the number just keeps climbing. So we really appreciate that you're taking time on this Wednesday evening to be with us. It really shows your dedication to promoting mental health and to our community overall. So we're really thankful to have you here today. On behalf of all of my coworkers and the group who you're going to see many of the members soon they're actually going to be our presenters. We're really thankful to have you here. Oh, it's fantastic to see all of your comments here. We're so glad to have you. And actually, I'd like to welcome onto the screen just very quickly, if you want to turn your videos on, my co-chairs for this group, Judge Ginger Lerner-Wren and Dr. Sandra Comfort, just if you want to wave and say hi.
And thank you all for being here.
Welcome everyone to all our mental health champions.
Thanks so much. So now, without further ado, let's get started. I'm going to pass over the mic to Gail Moore, who's a community relations specialist at 211 Broward, to tell us a little bit more about our event today.
Hello, and thank you all for joining us this evening as we discuss this very important topic of mental health. And there's no denying that life often feels very weird right now. We're going through a period of transition, and even before the pandemic, our nation was experiencing a mental health crisis. Over 51 million Americans experience a mental health condition, but only a percentage of those ever receive treatment. And it doesn't have to be this way. During this event, we are going to define mental health, the prevalence of mental health conditions, the importance of ending stigma, substance use, and suicide prevention. We're going to discuss tips for promoting well-being and resources to get assistance. If you or someone you know needs help, there is help. Now, this event may trigger some intense feelings. If you find yourself impacted, please dial 211 to speak with a counselor. Now, and I don't know if you feel the same way, but everything seems very stressful. Mental health impacts how we deal with that stress, and our bodies react when something is wrong. And so often we feel that we have to manage everything on our own. So most importantly, this event is about finding your voice. Everyone can be an advocate. Mental health matters to all of us, and all of us can make a difference. If you or someone you know is dealing with mental health issues, reach out to them. You may be the only person who intervenes, and you could be the catalyst for change they need. Become an advocate. Speak out. Reach out. But do something, even if it's one thing, to make a difference in mental health. With all of the challenges affecting our daily lives, it is okay not to be okay. But no one should have to suffer alone in silence. And if you are not okay, there's help. Mental health includes our emotional, psychological, and social well-being. It affects how we think, how we feel, and how we act. It helps determine how we handle stress, how we relate to other people, the choices we make. And it is important from every stage of life, from childhood and adolescence through adulthood. And it is essential. Mental health and emotional well-being is essential to your overall health. Mental health, it's a state of well-being in which an individual realizes their abilities, can cope with normal stresses, and can work productively and is able to make a contribution to their community. Positive mental health allows people to realize their full potential, like doing well in school or excelling at work. It helps cope with the daily stresses of life. Like, imagine the last time you had to deal with some stress. And lately, stress is part of everyday life. So, being angry or sad makes dealing with that stress much more difficult. Helps you work productively. It is so difficult to focus on any task if you're upset. And our early childhood experiences have lasting consequences. So, fostering emotional well being from the earliest stages of life helps build a foundation for overall health. If you don't learn how to deal with stress in childhood, learning that skill as an adult is much more difficult. Anxiety and mood disorders like depression, impulse control disorders are all associated with a higher probability of risky behaviors. Tobacco use, alcohol use, other drugs, risky sexual behavior or gambling, intimate partner and family violence. And our bodies react when something is wrong. Many chronic and acute conditions like diabetes, heart disease can lead to premature death. And all of these can have a root cause in mental health issues. According to the World Health Organization, mental health is fundamental to our collective and individual ability as humans to think, emote, interact with each other, earn a living, and enjoy life. And with there is no health without mental health. On this slide, you can see the actual physical impact on the brain of mental health disorders. On the left, you see a normal brain scan, then the scan of someone with depression, bipolar disorder, schizophrenia, and obsessive compulsive disorder. There are physical changes to the brain that are caused by mental health issues. Mental health is as important as physical health, and keeping our brains healthy is as important as keeping our heart and other organs healthy. Mental health conditions should be viewed like any other physical illness, and many factors contribute to mental health problems. Biological factors such as genes or brain chemistry, life experiences such as trauma or abuse, and a family history of mental health problems. Mental health problems are common, but help is available. We definitely want to make sure you leave with the message that although these exist and although they're common, help is available. People with mental health problems can show a decrease in the impact of those symptoms, and getting back to leading a full life and not having mental health concerns stand in the way of living that life. And how are you going to know if someone you love or someone you know is experiencing a mental health concern? Well, it's important to see the early warning signs because early intervention is critical for a positive outcome. And how do these look? It is important to note that just because a person exhibits one of these symptoms, it does not mean they absolutely have a mental health issue. Eating or sleeping too much, unexplained aches and pains because mental illness hurts, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, severe mood swings, hearing voices or believing things that are not true, thinking about harming themselves or thinking about harming yourself. If they're unable to perform daily tasks like taking care of themselves, taking a shower, getting to school, going to work, any of those can be an early warning sign that there's something more going on. When we look at the prevalence of mental health conditions, over 51 million Americans have a mental illness. That's over 20% or 1 in 5 adults. Over 51 million. Over 13 million have a serious mental illness like schizophrenia. Depression is the leading cause of disability in the US, affecting about 19 million adults, or 8%, and 4 million adolescents, or 16%. annually in the US. Approximately 48 million US adults have an anxiety disorder, and anxiety disorders frequently co occur with substance use disorders. Think about it. When people are upset or anxious, they may reach for a drink or something else to take the edge off. And alcohol and drugs just make things worse. Nearly 50% of US adults will experience at least one mental illness at some point in their lifetime. Mental health is everyone's problem. Now, my colleague, Marcia Pink with Florida Counseling Services, will speak about depression.
Good evening. This slide shows you the diagnostic criteria that's associated with this diagnosis. Now, most people are going to experience some of these symptoms some of the time, but if you or someone you love has experienced several of these symptoms that have lasted for more than 2 weeks, it is important to reach out for help. The first two symptoms are what are known as the hallmark symptoms: feeling down, sad, blue, depressed, and or having no interest in or pleasure in activities that used to be pleasurable. So depending on whether the person has one or both of the hallmark symptoms will determine how many of the other symptoms would be needed for the diagnosis. But what is important is change. Are you sleeping more or less than you've usually been sleeping? Are you eating more or less than usual? Are you feeling more tired or more agitated? Do you have difficulty making small, simple decisions? It's also important to have a physical exam to rule out physical causes as well. Now, sometimes a person may experience something in their life, a death in the family, and so 2 weeks later, we're not expecting them to be jumping for joy and going out partying, but at least 2 weeks later, are they getting dressed and leaving the house to go get a container of milk? Those are things that you want to look at. Untreated depression often becomes worse and leads to a disruption in daily functioning, and sometimes suicidal thoughts, and in the worst case, suicidal behaviors. But treatment works, and an individualized treatment plan will be considered for each person. And self-awareness is important for those seeking professional help. As a result, encouraging someone you care about who is experiencing depression to seek help is critical. Depression is a brain disorder. People experiencing depression have a dysregulation of serotonin, a neurotransmitter in our brain that determines how we think and how we feel. Sometimes individuals are resistant to their diagnosis of depression because, unlike other medical illnesses, there is no blood test to demonstrate this reduced serotonin. Functional MRIs are currently used only in the research setting. The left scan shows the brain activity is reduced for a person with depression compared to, on the right, the average brain. I don't like to use the word normal, I like to use the word average. So you can see the difference in those two scans. There are also other mental health conditions. This is just a small listing of the many, many hundreds of different diagnoses listed in the DSM. Alzheimer's disease is an irreversible progressive brain disorder that slowly destroys memory and thinking skills, and eventually the ability to carry out even the simplest of tasks. Anxiety disorders are a group of illnesses characterized by feelings of worry, anxiety, fear that interfere with one's daily activities. Anxiety disorders include panic disorder, phobias, generalized anxiety disorder, obsessive compulsive disorder, known as OCD, and post-traumatic stress disorder, PTSD, one of the most common mental health disorders. Many people have fears, but how it interferes with one's life determines whether there is a need for treatment. Attention deficit hyperactivity disorder, ADHD, causes an above average level of hyperactivity and impulsive behavior, and it's one of the most common childhood disorders. ADHD often begins in childhood, but can continue into one's adulthood. Bipolar disorder includes episodes of mood swings ranging from those depressive lows to the manic highs, and often affects one's ability to function in their day-to-day, causing someone to have unrealistic thoughts and beliefs. Eating disorders, which include anorexia nervosa, bulimia nervosa, and binge eating, are serious and sometimes fatal illnesses associated with severe disturbances in one's eating behaviors and related thoughts and emotions, including a preoccupation with food and body weight and physical appearance. Psychotic disorders, including schizophrenia, are characterized by delusions and hallucinations, and it affects only 1% of the population. The first symptoms often are experienced by college-age individuals, yet it often takes years to receive a diagnosis, and this lag time leads to greater lifetime disability. So why don't people get treatment? Well, stigma is often the barrier. Stigma involves the negative or discriminatory attitudes that others have about mental illness. Self-stigma refers to the negative attitudes, including internalized shame that people with mental illness have about their own condition. They confuse feeling bad with being bad. Stigma comes very often from misinformation and fear. It can lead to isolation, blame, and secrecy that creates challenges to reaching out and getting the help and support that they need in order to live well. Here are some of the myths that people propagate about mental illnesses. Mental health problems are rare. Not true. Mental health conditions are actually very common, affecting 20% of US adults. Gail gave you some of those statistics. There are highly regarded individuals in our community with influential positions that have experienced a mental illness. Children don't experience mental health problems. Who said so? It's wrong. Even very young children may show warning signs of mental health concerns. Recent research has shown the need to address mental health during infancy. Half of all mental health conditions exhibit symptoms before the age of 14 and 75% by the age of 24 with a lifetime impact. So some people might say that people with mental illnesses are violent and unpredictable, but the reality is, the fact is that people with mental illness are no more likely to be violent than anyone else. Only 3 to 5% of violent acts can be attributed to individuals living with a serious mental illness, and that just happens to be a coincidence. I mean, violent acts can happen to a person who happens to have some other kind of illness as well. And in fact, people with mental illness are more likely to be the victim of violence than the perpetrator. And persons with a mental illness are 10 times more likely to be a victim than someone in the general population. Here's our next myth. People with mental health conditions, even those who are managing their mental illness, cannot tolerate the stress of holding down a job. Well, someone with a mental illness is just as productive as any other employee. And employers have reported that persons that they've hired with a mental illness have good attendance, punctuality, and sometimes their motivation and their job tenure are even greater than other employees. This relates, of course, to those persons with a mental illness who have gotten treatment. That's the goal. Mental illnesses are a result of personality weakness or character flaw. There can be nothing further from the truth. Many factors contribute to mental illness, including one's genes, physical illnesses, injuries, brain chemistry, life's experiences, family history. But mental illnesses are medical illnesses affecting the brain in the same way that heart disease affects that organ of the body. Mental illnesses are treatable with higher success rates than some physical illnesses. But it's a myth to think that people with mental illness can just snap out of it if they just try hard enough. You probably know someone with a mental illness and don't even realize it. Many people with mental illness are highly active and productive members of our community. I'm not much of a costume person, but when I went to a Halloween party a few years ago and I was asked, "What are you wearing?" I responded, "I'm dressed like a person with mental illness. You see, we all look alike." But we can combat stigma with education. Learn about mental health, mental illness, and behavioral health, and teach others. Congratulations for being here tonight. You're going to learn a lot, and I hope that you will share it with others. That's part of it. Learn about it and teach it to others. Be conscious of your words. Words matter so much. They can be so hurtful and they can be so powerful. Model compassionate behavior towards others, and let others know when they are exhibiting stigma. Our media outlets very often need this kind of education in the way that they do some of their reporting. This is a card that was produced by the MHPAT committee as part of the commission, and they are available from the commission. And when we're talking about language, mental health language matters. Be respectful. Use person first language. Don't identify someone by their illness. We don't say she's cancer. Saying I'm a bipolar person is taking a noun and using it as an adjective. Bipolar is an illness, not a description. Even with physical illness, it's like chalk on a blackboard to me when I hear I'm diabetic instead of I am a person with diabetes. People are a lot more than their illness. Remember, person first language. And there are some other factors that affect mental health as well. And we're going to talk about these factors tonight. Physical illness, environmental stressors, adverse childhood experiences known as ACEs, and situations for specialized populations. Physical illness, co-occurring and coexisting mental illness can negatively impact one's ability to cope with and recover from some physical illnesses. Depression co-occurs with some of the most common physical illnesses, and mental illnesses sometimes co-occur with each other. Complications from a physical illness can result from depression, and depression can result from the physical illness. And it's not just sadness over a diagnosis, but it is a biochemical change that happens as a result of that physical illness, and sometimes the medication used to treat that illness. And now, Dr. Harleen Hutchinson, VP of Florida Association of Infant Mental Health, will discuss some more of these factors affecting mental health. Thank you.
Hello, everyone. Good evening. I am so glad that you are here to learn as much as you can about mental health, because mental health does matter. So environmental factors are things that affect our mental health. Also, when these things occur, it becomes very difficult to maintain a good balance of physical, emotional, and psychological well-being. Here we see some examples of social factors like poverty, systemic racism, the pandemic, and workplace stress that can really influence our mental health and emotional well-being. So it's extremely important that we're able to recognize when these stressors are taking place. We also know that COVID-19 is one example of environmental factors that have affected us at different levels, especially our vulnerable population and disabled individuals who were greatly affected by loneliness and boredom. Schools have also been confronted with challenges as they shift to online classes. This has created much worry, stress, and grief for our youths. These stressors have also caused mental health challenges and may have worsened symptoms for those youth who have had a pre-existing mental health condition. But we also tend to forget that our youths are extremely resilient, and that in spite of the many challenges, you guys were able to bounce back. Also keep in mind that when we think of environmental factors and our mental health, everyone will respond differently based on their level of support in their environment. Some may react with anxiety, worry, uncertainty, and ambivalence. COVID-19 has also impacted all of us across the lifespan. CDC reported that in June 2020, 3 months after the lockdown, that 40% of adults reported having mental health or substance abuse challenges. So we see that anxiety and depression were the leading cause of mental illness for many due to shelter in place and the uncertainty that it brought about. We also see that some groups such as younger and older adults, essential workers, and certain minority and racial groups experience a disproportionately worse mental health outcomes than others. When we think of mental health in the workplace, we know that mental health and physical health as chronic condition goes hand in hand and impacts employees' whole health. We also know that poor mental health leads to negative outcome for employees, such as employee turnover, loss of productivity, employee absenteeism. So as you can see, these are some outcomes when the workplace does not promote a culture of good emotional wellness. So these are some ways of promoting mental health and stress management in the workplace. Things like creating a culture where employees feel valued and are able to work with less stress. Also providing a culture that supports time off, providing flexibility to employees and allowing them to take small breaks are also important ways of improving employees' mental health. Workplace health promotion programs also have proven to be very successful, especially when they combine mental health, physical health, and intervention that actually support employees' emotional wellness. On this slide, we see factors that actually affects mental health. So adverse childhood experiences, also known as ACEs, are traumatic events that are associated with severe problems later on in life, like was mentioned earlier, which means that the adversity we experience in early childhood can affect us into adulthood. So when young children are exposed to chronic stressful events and face challenges in school, challenges in their life and with their health, these often are symptoms of ACEs and toxic stress. Also, a child's cognitive functioning or ability to cope with negative emotions may be impaired. We also find that during adolescence, children may adopt negative coping mechanisms such as substance use or self-harm to cope with all of those stressful or traumatic events that's taking place in their life. Here we see on this slide, A stands for adverse childhood experiences. And these experiences can include things like abuse, neglect, and household dysfunction. Furthermore, we see that physical, emotional, sexual abuse, and substance abuse are also stressors that impact one later on in life. But what we do know is that the more ACEs a child experiences, the more likely he or she will suffer from things like poor academic achievement, heart disease, diabetes, and substance abuse later on in life. So experiencing 4 or more ACEs can cause toxic stress, which can lead to long-lasting wear and tear on one's body. But however, the good news is that fostering a strong, supportive relationship with a caring adult can help you to buffer these negative experiences of toxic stress. Another factor that impacts our mental health is those specialized population. So significant mental health problems can and do occur in children. Some of the most common type of mental health problems that we see in children are anxiety, ADHD, PTSD, and depression. Children can also show signs of depression as young as 3 months old. Also, young children respond and process traumatic events in ways that are very different from adults and older children. Therefore, diagnosis in early childhood can be much more difficult than it is in adults. You can see from this chart that mental health problems is a concern. Nearly 30% of college students reported feeling depressed and unable to function at some time in the last year. As you can see from this chart, mental health does affect our youth population. And 13 to 20% of children living in the US are experiencing mental health problems, and it is a concern. And half of children half of youths in their lifetime have experienced a mental health problems by the age of 14. We also see that African American youth are likely to experience more illnesses, poverty, and discrimination than their white counterparts. So these issues also put them at higher risk for depression and other mental health problems, like anxiety and feelings of hopelessness. Yet we see they're less likely to seek treatment. Instead, some will turn to suicide. And they will also not seek treatment due to stigma. There's also stigma associated with mental illness and seeking help, which affects African Americans' ability to cope. The impact of racism and systemic racism also impacts their overall ability to cope, and this affects their mental health. But let's not forget that resiliency also plays a key role in the emotional well-being of all African American children. Protective factors such as their community, the church, extended family, all play a crucial role in their ability to cope with adversity. I will now turn it over to my colleague, Joel Smith, who's the director of the Family Initiative for Suicide Prevention. He'll be focusing on the LGBT population.
Good evening, everyone, and thank you for being here, and thank you, Dr. Hutchinson. Well, I have a lot of questions, and I've already learned a lot. So I hope you in the audience are accessing the Q&A and putting your questions in there. Mental health is an arc across our lifetime, and specialized populations, we need to be responsive and understanding of the LGBTQ population in our community. And I'm excited to share with you that Broward County is a destination for and home of a very vibrant LGBTQ community. So we have an opportunity to learn quite a bit from our brothers and sisters who are in the LGBTQ community and can help us as we address, as Marcia said earlier, the stigma that may exist or the sensitivity to factors that are unique to the LGBTQ community. For example, we know that the effects of discrimination make them more vulnerable to mental health problems, to deeper depression, to substance abuse, and ultimately, if not treated, and they sink to a level of hopelessness, the potential for suicidal ideation or actual attempts. You can see from this information, gay, lesbian, and bisexual youth in the 14 to 21-year-old age range are much more likely to report depression and anxiety than their heterosexual peers. They're more likely to attempt suicide, with attempt rates that are 20 to 40% higher among non-LGBTQ youth. And if you look back at the previous slide that Dr. Hutchinson shared, LGBTQ youth who are also Black or brown, that number shoots up even higher. There's a multitude of challenges that culturally people in these populations face that we need to provide supports for. We do know, and the Trevor Project has done tremendous research showing that when LGBTQ youth are accepted by both parents, there are many, many, many lower levels of depression, anxiety, of all the arc of mental health concerns because of a nurturing, engaged, whole experience. As I expect you know, disclosing any unique circumstance, and particularly for an adolescent, sexual orientation can be extremely stressful. And so to bring that out for an LGBTQ youth maximizes that stress, particularly if there's a fear that in their unique family structure or extended family, there will be negative reactions. Oftentimes, depending on the family's religious background, that may be a serious challenge. So for some, coming out can cause a major family risk and may put them in physical danger in the family or rejection from the family. Older adults, again, Broward County has, and all of Florida is a target for older adults to migrate to because of our terrific weather, and the warmth makes comfort on things like arthritis and joint pain. But it's important to note that as we age, the wear and tear that all of my co-presenters were sharing earlier impact the ability to function. And many older adults suffer from depression, early onset Alzheimer's or full Alzheimer's, and then other related dementias and anxiety. The risk factor surveillance data shows that among older adults, 7.7% reported current depression and 15.7% reported a lifetime diagnosis of depression. Now, that doesn't mean they're not being treated or functioning successfully, but it does mean that there's a long-term risk involved. Later life depression, depression that starts after the wear and tear of an earlier lifetime, affects about 6 million adults, but less and less receive treatment for a variety of reasons: separation from family, living in a unique and a lonely circumstance, a sense of this is the way things are. Older Americans by percent are more likely to die by suicide than any other age group, not in total number, but in percent to the population. And that's very critical. And so much of that is a response to loneliness or early onset dementia or inability to deal with the illnesses that they're facing. You can see 10 to 20% of widows and widowers follow up the loss of their spouse with a depression within 1 year of their spouse's death. This is true no matter how long the marital situation existed, whether it's 1 year or 40 years. But obviously you would guess that the longer time a relationship existed, the depth of concern when one spouse is deceased becomes very dramatic. It's very important that we identify depression in older adults, but it's a little complex because they often have overlying medical illnesses and a unique usage of prescription drugs, which may either mask the symptoms or may present symptoms that aren't accurate. As all of this says, aging presents unique challenges. I'm sure most of our young audience cannot specifically relate to this, but if you start to think about over time, perhaps the relationship you have with your grandparents, are they more forgetful than they were a couple of years ago? Do they have less energy? You start to get a sense of those kinds of things. Impact on their vision or hearing loss. Hearing loss is a very, very, very common part of aging, and it can impact not only equilibrium and straight hearing loss, but also the inability to communicate effectively. So let's define behavioral health. I think most of us are familiar with the term mental health, and I think my partners have described that extremely well, that people can suffer from a variety of mental health concerns which come from a variety of places: physical, emotional, environmental, and so forth. But the field of behavioral health includes many of those same areas, but also addresses some of the unique factors that impact wellness, substance use and the abuse of substances. And of course, we have at the United Way Commission on Mental Health and Substance Use a very strong resource in our community to support not only the research into these issues in our community, but the potential ameliorations or treatments that help people recover from them. Behavioral habits are another kind of an intervention or a situation that demands intervention. Some of that could be things like uncontrolled eating, but it can also be an inability to stop cussing, for example, or risk-taking behavior. So there are a number of factors that are unique to the behavioral part of our holistic self that can be separated out from strictly the mental health issues. mental health and substance use disorders often exist in partnership. That's called co-occurring. And we need to be very careful of that because obviously certain illegal drugs cause people within an addiction to experience any number of symptoms of mental health. And when you have a co-occurring circumstance and you get, say, the substance abuse to some degree of control, you really haven't solved ultimately the person's challenge, because the initial challenging issue still exists. Mental health problems, though, can somewhat be the trigger that lead to risk-taking behavior, which can be considered use of alcohol, smoking, or substance or any drug use. And in order for us to feel more comfortable with our life, we can often use these kind of resources or tools with the misunderstanding that they will make us feel better, and we use it as a form of self-medication. These disorders share some underlying causes, such as changes in the brain composition, the chemical flow flowing through the brain, the degree of stress a person lives under, of course, genetic vulnerabilities. We all have thousands of years of genetic packaging that to some degree is stable over time, and to some degree changes over time based on life experiences, location, religious and cultural experiences. And of course, as Dr. Hutchinson said earlier, we're learning so much more now about the early exposure to stress and trauma and how that changes the arc of wealth, of mental health for the individual, for the child becoming an adult, both physiologically and emotionally and psychologically. It's interesting to note that 25% of adults who are living with a serious mental health problem also have a substance use problem. Again, that problem may have occurred because of prescription medication use or abuse, or seeking self-medication to feel better. And these problems include, as we've discussed earlier, the depression, anxiety disorder, schizophrenia, and personality disorders. You can see here how critically important the controlling the risk behavior is on the impact of your brain. I think it was Gail who shared earlier the structure of the brain, and I think Marcia did also. Well, you can see substances, smoking, substance abuse, alcohol can impact the way the neurons communicate in the brain. And what you see here in the bright areas is basically the brain firing and working. And so and when you see the substances, it shows how it minimizes the function of the brain. The brain also turns down its response to healthy, pleasurable activities because you've misused the coping mechanism. You've misused the tool to bring yourself back to a level of calm. So these have short and long-term effects which change the trajectory of wellness, personal wellness, and the impact on the wellness of your family and friends because of what you or one of them might be suffering. Mental illnesses, like any illness, while they impact the unique individual, have a ripple effect impacting the people around them, their loved ones, the people that they care for. So using these risky substances has a whole life impact. And in my field, I do a lot of work with suicide prevention, and it's important to be aware that every 12 minutes, someone in the United States will take their life because of a suicide. And the suicide rate for individuals with mental illness and mood disorders is 25% higher than that of the general population. I think you could predict that. And to Dr. Hutchinson's point earlier about ACEs, people with 4 or more ACEs have a susceptibility to risk behaviors, of which obviously deepest one is death by suicide. It's interesting to note that males take their lives at nearly 4 times the rate of females. They represent about 78% of all deaths by suicide. And males often take their life using a weapon, a gun. Females have a significant number of attempts, but much less successfully, and they're often aligned with things like overuse of medication. And it stands to reason why they're not as used as facetiously successful, because when you take medication, it's not instantaneous. So you have an opportunity to have a second thought or to have someone come and see that you're struggling. You can see here that the highest rates of suicide per 100,000 are in the middle age groups. And that's very concerning to all of us. And that's one of the things we talked about just a little bit earlier in terms of the elderly population. But for youth, which now we know is up to young adult, 25 to 34, is the second leading cause of death over every other form of death: car accidents, cancer, any other cause of death. Death by suicide in the ages 15 to 24, and then above that, 25 to 34, are the second most common form of loss of life in the United States. And we're very concerned because we're seeing a lot of suicidal ideation plans and even attempts in younger and younger people. And one of the great things about a presentation like this is it gives you an opportunity to think through all of the things that are impacting life so that we can work together to maintain the arc of wellness, the arc of health, by reaching out to each other. So seeking help is a strong way to deal. And back to what Marcia was talking about, stigma. Stigma is one of the blockers to getting help. But we need to know the facts and know that these are mental illnesses, just like cancer or heart disease or obesity. And so we should treat them like any other illness. If you have heart disease or diabetes, you go to the doctor. If you have an emotional or a mental illness or disruption, there are terrific treatments available. Unfortunately, rates of suicide, death by suicide, have increased in every state over really the last 20 years. It's also important to note that death by suicide is rarely caused by any single factor. And oftentimes people think death by suicide is an impulsive behavior. But what it is, it's an impulsive act that is a response to a continuum of illness. It is a response very often to the sense of pain, to the sense that there is no hope to go on. And our job is to provide a climate for you where you understand that there is hope to go on. Many people who die by suicide, it can be invisible to us, and we wonder what happened. Because people with mental and emotional illnesses, because of the stigma, because we expect people to get better on their own, keep their concerns at a minimum, keep them hidden from people. And of course, other factors which I think stand to reason are breakups in relationships or disequal relationships, substance abuse, physical health concerns, financial problems, housing stresses, legal problems, employment challenges. So in closing, for me, we're seeing big challenges over and above everything we talk about as a result of this 12 months of social isolation, and the fact that people lose their jobs or that have financial challenges or are food deficient for their families. So coming out of this, we need to all be together and care about each other and access the resources that are available in Broward County so that we can ensure that coming out of this, we can be healthy. Just to share quickly some of the risk factors to look out for, not that dissimilar from what was shared earlier, but I'd like to highlight a few. But I also want to say, again, these are not things that you see today or tomorrow, but that you see in a person over time. So clearly dealing with long-term mental health issues and disorders. Clearly alcohol and substance use disorders. I'm going to skip hopelessness for a second. As Marcia said earlier, when you're seeing this, the person change to being a calm person to be impulsive or aggressive over time, when you know, and it's not hidden, the history of trauma or abuse in their family, dealing with physical illnesses can be emotionally draining. Clearly, we want to be concerned about anybody that has a previous attempt to take their life by suicide. The good news is that most people who make an attempt, 90% or so, don't make a second attempt. The bad news is the 10% are seriously at risk of either taking another attempt or seriously completing the act. We have to be concerned about a family history of death by suicide. We have to be concerned about things I already mentioned, like social emotional changes like job loss, financial loss, and sometimes it could be job gain as well, the stress of a new situation, loss of relationships. This is a big one. Easy access to lethal means. Men die by death, by suicide, by using a gun. Guns need to be protected and locked up. Not making a political statement about whether a person should own a gun. I'm saying they need to be controlled. So easy access to those means, including, medicine chests, parents' medicine chests. Local clusters of suicide. This particularly impacts young people. And we've seen some of that in Broward County in the not too distant past. Lack of social supports. We need to rely on each other. And finally, because I need to move to the next presenter, if all of these come together and create an endless sense of hopelessness, like there's no light in an endless tunnel, you're in a dark black tunnel that you can't get out of, you can get out of it. But if you don't feel you can get out of it, we need to provide the supports for you. There are a couple of steps if you feel one of your friends or family members are at risk. Ask them directly. You will not cause them to die by suicide. That's one of the myths. But if you're concerned, ask them. If they tell you they are at risk of taking their life, we have to keep them safe. Do not go to get help and leave them alone. Stay with them. Use your phone. Make sure, as best you can, that there are no lethal means available. I'm not asking you to grab a gun. I'm just saying make sure that they're not in a place where the gun's available or at the medicine chest. Listen to them. Do not be judgmental. Do not tell them they can do better. Just listen. They are in pain. They are experiencing what they're experiencing it. You cannot experience it. I cannot experience it, but we can be there to be supportive. Help them connect. This is critical. If they are at risk, you have to call 211. Gail's going to speak in a minute. You have to reach out for help. You can save a life. These numbers, 211, that's available 24/7. They're always available. And there's a specific hotline for people at risk. We together are each other's support system. So we have to care about each other, and then we have to follow up because people need to know that caring doesn't stop when you're off the phone call. So I'm excited to share these steps with you, and I hope that you've internalized them. And with that, I will turn it over to Gail.
Thank you so much, Joel, and thank you so much for taking us through that very serious topic and giving us a lot more insight. Now, what I'm talking about now are your treatment options, and there are many treatment options. And of course, the first thing you want to do is to speak with your doctor or your therapist about what treatment options are available to you. There's medication, there's therapy, there's a combination of medication and therapy. The important thing to know is to find the treatment that's right for you and to stay the course. A lot of times people expect treatment to maybe just, one and done. And it may not be quite that simple. So staying the course and working with your clinician or your doctor is so very important. Building resiliency. Now, building resiliency is really important to good mental health. And good mental health can be defined by the degree to which a person is resilient. Resiliency is the ability to bounce back from life's challenges. Resiliency can be described as being hopeful, and it is built on a foundation of protective factors which begin in childhood. Protective factors buffer against risk and otherwise adverse circumstances, such as stress or trauma, by either reducing the impact of that risk or changing the way a person responds to it. Protective factors may decrease the likelihood that individuals engage in negative activities. Building on existing protective factors makes people and communities stronger and better able to counteract risk factors. Joel talked about LGBTQ positive youth with supportive families having lower levels of depression and anxiety. Supportive families are a protective factor. And we have gotten so many good questions from people seeking help for family and friends. You are a protective factor. Additional protective factors include positive community support, positive physical development, high self-esteem, good coping skills, and good problem-solving skills. And if you're familiar with a Venn diagram, this picture will definitely make a lot of sense to you, is when we see that when two areas merge, when we see that area in which they overlap. See, wellness includes good mental and physical health, but also extends to several other domains. It's not just the absence of illness or stress. It includes actively pursuing activities, choices, and lifestyles which allow us to thrive. And you can strive for wellness even if you're experiencing challenges in some domains of your life. Because mental health and physical health are linked, hurting or improving one area can affect the other. It's important to make healthy choices for both your physical and your mental well-being. There are some methods of self-care that help and promote mental wellness. Connecting with other people, eating well, getting enough sleep, getting physically active, that builds endorphins to feel good. Taking care of your spirit, helping other people, avoiding drugs and alcohol. And of course, these are not a replacement for getting professional help if you need it. Promoting mental health involves everyone in the community. And I really wish I had the time to really delve into each one of these, but they're all important. If states were to ease the unemployment and the housing issues, that helps people feel better knowing that they have a secure housing. Employers can and should create protective environments and workplace cultures which promote mental health and positive well-being and reduce the stigma around mental health. Schools, we have a lot of students here today, and I'm so grateful you're here because schools can teach students how the skills to manage challenges like relationship and school problems, teach them valuable coping skills. Everyone, everyone here can learn the warning signs, how to support other people, and where they can get help. At every level, we have the power to make an impact. These are some resources, and these are so valuable. I want you all to take a screenshot of these resources. Save them, forward them to your networks. First off, If you or someone you know is in immediate danger, call 911. 211 Broward serves people in crisis by providing 24-hour telephone counseling. We also have text counseling available from 10 to 8 Monday through Friday, emotional support, suicide prevention and intervention, and links to community resources. If you don't have insurance, if you speak a language other than English, if you've never sought treatment, if you have a limited income, we're here. 211 also visits schools and organizations to discuss mental health and support, and our services are absolutely free. Since the beginning of the pandemic, in addition to financial needs, 211 has seen a great increase in mental health and substance abuse related calls. You're not alone. So many people are experiencing the same issues and traumas, and it's so important for us to realize that these issues don't necessarily just go away on their own. There's help available. All 211 counselors are trained to handle crisis and suicide calls. The goal is to ensure safety, identify critical issues, provide emotional support, and engage outside interventions if necessary. If you or someone you know is in distress, drinking more than normal, taking drugs, crying all the time, angry, or just seems unable to cope, we are available by phone 24 hours a day. 211 First Call for Help is where you call when you don't know where to call. And now I will ask you to take a look at these other valuable resources, and I will turn the presentation back over to Ms. Coral Cohen.
Thank you so much, Gail, and a huge round of applause to all of our presenters this evening. You were all fantastic, fantastic. Thank you so much. Gail, Dr. Hutchinson, Marsha, and Joel, thank you so, so much from the bottom of all of our hearts. And on behalf of Judge Wren and Dr. Comfort, in addition to myself. A quick note regarding the resources. Yes, we have so many amazing resources on this slide, so please do take a screenshot, as Gail mentioned. But in addition to that, I know many of you here are Broward County High School students. So there's actually another resource that you can use if you notice in the top right corner of your slide. There's the Talk app, which you can access through your Clever student portal. And actually through that, you can really easily submit an application or really a quick form, and you'll get connected to a school counselor who will actually reach out to you from Broward County Public Schools and follow up on that. So please take advantage of that as well. I know that many of you have already. So please continue to do that. All right, so I really hope, stay with us because we're gonna go until 8:30 and we're hopefully gonna have some time for audience Q&A, but I just wanna wrap us up a little bit in terms of the presentation. So on behalf of everyone at the Mental Health Promotion Action Team, including our presenters and our co-chairs here today, as well as United Way of Broward County more broadly and our Commission on Behavioral Health and Drug Prevention, we really hope that today's event has inspired you to become a champion for mental health in your community, or in your various communities, I should say, because there's really different levels of communities, right? There's your school, there's your family, your friends and your social circle, maybe different organizations or activities or volunteer groups that you're part of. So we like to think really broadly in terms of what can be construed as your community. And of course, we like to think of all of Broward County and even beyond that, all of South Florida. I know that we have some others, some joining us from other counties here today. So really hope that this has inspired you to become a champion for mental health in all of these different communities. And before I go on to the next slide, I also just wanted to say that we really hope that this presentation, this event today has motivated you to actually want to do some things. So one important thing is to take in and absorb as much of this information as possible, right? And maybe you're even inspired to do some more research on your own, or maybe you have some trusted adults that you can look into, reach out to. Also, you can look into many of these websites, especially in the latter half of the screen for some more information, such as National Alliance on Mental Illness, Mental Health America of Southeast Florida, and of course our own website, United Way of Broward County, which I'll include on the next couple of slides. So that's number one, right? Taking this information and really bringing it into your mind and your mentality. Then number two, remember these resources, okay, and then use them if you need to reach out to somebody, whether it's if you're in an extreme crisis in that moment, such as you might be considering suicide, but also beyond that, right? So if you're dealing with substance use issues, or you would like to quit vaping or smoking or using alcohol or whatever it is, or also if you would like to see a counselor, if you're struggling with different mental health conditions more long-term, even if it's not a crisis, especially if it's not a crisis, right? Because it's really important as far as early on as we can to start to work on these issues. And then finally, to make sure that you ask those around you, ask your friends, family, and even somebody else that you interact with, check in how they're doing. And especially if you see something concerning, you think something might be wrong, ask them how they're doing. So those three things: remember the information from today, remember these resources and use them, even if that includes giving them to somebody else and having somebody else get connected to these resources. And finally, remembering to check in on the people around you and your loved ones. Okay, so now we have some more opportunities for you to continue connecting with us today. So our Mental Health Promotion Action Team, we meet on the third Friday of every month from 12:30 to 2 p.m., currently through Zoom and physically at United Way of Broward County when that resumes. This is for adults. And so if you are an adult here today and you would like to participate in our meetings and in our communities and be able to share resources with us, please send me an email. Again, my name is Carol Cohen and my email is there on the screen, ccohen@unitedwaybroward.org. If you're a student, then for middle and high school students in Broward County, we actually have the Broward Youth Coalition. It meets monthly during the school year. Currently, again, we're doing that through Zoom. Our next and final meeting of the year is actually tomorrow. And hopefully next year we'll be back to even doing it in person. And we actually have multiple locations. So if you're at one of these three high schools, Atlantic Technical High School or ATC, Fort Lauderdale High School, or South Broward High School, we actually have a club for the Broward Youth Coalition located at your actual school. And if you don't, then no worries, because we have the fourth one, which is community-wide, which I actually co-lead with my coworker, Jenna Stein, who's helping us behind the scenes here today. So in order to learn more or sign up, please go to the website and the link right here. It's unitedwaybroward.org/Broward Youth Coalition. And maybe Jenna can help me out by putting that in the chat for all of you. So again, if you're a middle and high school student in Broward County at any of these three high schools, or possibly we're going to have some more locations next year, hopefully, or if you would like to be part of our community-wide, just go to that website. You'll have some more information there, and there's actually the application where you can click, register, fill out the application form, and we will be in contact with you and help connect you to advisor if you have it at your school, and if not, we'll just bring you on board with that. We also have our big annual 2-day conference, Youth Leadership Institute, taking place virtually over Zoom on June 16th and 17th, I believe, in the afternoon. So sign up there so we can send that information to you. So one more time, I want to thank you all so much for being here today. Now, if we may, I want to do something quick and open up the chat before we do our Q&A. So we'll open up the chat so you can use that again. And please take a moment to type in there something new that you learned today, one thing that you learned that you didn't know before. We would love to hear from all of you. So the chat's now open. You can type in there. Don't put in the Q&A, please put in the chat. And meanwhile, I will stop sharing my screen. And also remember there's the Florida Initiatives for Suicide Prevention for more information on suicide. If you have questions, please continue to put them in the Q&A right now because we're going to spend the next 15 minutes on Q&A. But if you want to answer one thing that you learned today, then please put that in the chat. Thanks so much. And in the meantime, I invite all of our presenters from today to come back onto the screen and turn your videos on so we can get ready for our Q&A section. And I know that you can't all turn on your videos in the audience, but I'm just gonna give them a quick round of applause on your behalf because I think they did an amazing, amazing job. These are all experts, as you can see, on mental health from across our community in different organizations, different topics, different specialties, and they all brought it to the table today. Okay, I see some, and also our co-chairs, if you want to come on, you're welcome to do so. So I'm seeing so many amazing comments in the chat. I'll just read a few. So I learned our brains look differently when we have different mental illnesses. The vast amount of resources we have available. I learned that kids, even as young as 3 months old, could suffer from depression. I learned some of the signs. I learned that there are resources for everyone, even if you don't think so. Something new I learned today was how people incorrectly comment about mental illnesses. That's a big one. That's something we're really hoping to change. And I'll actually send you a follow-up email in the next few weeks with those Language Matters cards that Marsha presented. We actually have one on addiction and one on mental health, and we have them in English and in Spanish now. I learned that asking directly about suicide won't put the idea in their head. We have Gonzalo saying amazing experts and leaders. Thanks, Gonzalo. So glad you were able to be here today. It was really interesting to learn how things like poverty and healthcare can affect mental health. The amount of young people who suffer with mental illness. I learned so many different things. Thank you so much. Thank you all for being here today. You cannot ever refer to people just based off of them being diagnosed with a mental disorder. That's absolutely correct. We're much more than any illness or condition that we have. Okay, there's a lot of them. I think we'll move on to Q&A now, but thank you so much. And it's amazing to see what you've all learned, and feel free to look at some of your other attendees' responses. They're really fantastic. I'm glad to see that you've all embodied all this information. Okay, so let's go on to Q&A. Okay, right off the bat, how can you help someone who doesn't want help? Who wants to take that one on?
I'll take that on.
Okay.
I think that's a great question. And not everybody is ready for help at any given time. But I think that, just being there and letting them know that you're there and available to talk anytime or chat or text or whatever, I think that caring, that kindness and compassion goes a really, really long way. And for those that are interested, there's a really wonderful ad campaign that really, really talks about this. You can go right online, and it's called Seize the Awkward.
Excellent. Thank you so much, Judge Wren.
Can I just briefly follow up on that and, just follow up on the wonderful words Judge Wren said, but I also think it's important for us to know that it's much easier to listen than to speak. And sometimes, although a person is not asking directly for help, they just want to be heard. So if you can take the time to just listen and just be there for them as a support, that's very important too.
I'd like to add to that just for a second, because I think Sandra said something very, very important. Lots of times people will physically show you that they don't want help while inside they're screaming for help. And so it's very important to kind of stay the course on your relationship with them, because sometimes when we don't feel the person is responding to us, we get mad at them, but they're suffering. they're dealing with this. And so we need to be supportive, even though it doesn't feel like we're always getting through. And it's important that we need to be there, be present for them.
And Joelle, I'd like to add on to that. And don't forget the healing power of relationship. Relationship is very healing, and especially that support. A lot of times it can get very lonely, but that positive support actually does make a difference.
Absolutely. That was all really well said. Thank you so much, everybody. Okay, let's go to another question. How can you bring up the conversation of mental health to parents?
Well, that's a little vague. I'm not sure that I understand the question, but one of the things I was thinking of is I've often said to people, just get a publication. National Institute of Mental Health has very science-based, reliable publications. Leave it in the bathroom and somebody's liable to read it.
Interesting. So I'm thinking maybe the question is asking how can you start a conversation about mental health with your parents? So maybe let's try to answer it like that.
Sometimes it's okay to talk about what we're feeling and what we're going through. And if you or someone you know is having any kinds of symptoms or signs of mental illness, it is always good to turn that thought and those words to yourself and talk about what I am feeling, what somebody else that you know is experiencing, and just sharing and making it seem as if you just want to know, you just want to learn, you just want to get somebody else's opinion. And usually from a parent, it's important what you hear and how you relate to them, because they want to talk to you. Sometimes you're just as scared to talk about things as you are to talk to them about things. So turn it on yourself or a situation that you're aware of, and make it a genuine issue to get started. And if later on it works where you can get a little bit more intimate in your conversation, then you can go there. But right now, make it be about you or about a situation you know of.
So often kids are concerned about letting their parents down, about not meeting their parents' expectations, about feeling they're going to be rejected because they didn't meet those expectations. So I think you have to process that. One way to process that is by reaching out to a person such as people are on this call, or friends, and kind of work through those issues. But I think it's also important to realize that adolescents and parents are like oil and vinegar sometimes. They don't always mix easily, but parents want their kids to be healthy. Parents, they may not know how to do it, but they don't want unhealthy kids. And so it's important, again, that you feel enough inner strength to get the help you need so you're on that arc of wellness. You can't be successful if you're not on that.
And then Joelle, I want to say to parents who are on the platform, if you're on the platform and you're a parent, be available and be willing to listen to your kids, no matter how painful it might be, because that's extremely critical for them to just have validation and to hear they're not alone.
Yeah, that's an excellent point, Dr. Hutchinson. It really goes both ways. And I think that speaks to Marsha's original not being sure how to answer that question, because there's many different angles when it comes to approaching that conversation from both sides. Okay, here's another question for all of you. What are some small everyday things to help a loved one with a mental illness?
Being there. I would definitely say knowing that you are support for them, that you're there to talk. If they're having problems, perhaps, getting out of bed, then maybe you can be there just to help wash some dishes, bring a meal, take the dog out, doing things that may not directly seem like therapy, but are actually very helpful if somebody is unable to do these things for themselves. Sometimes the smallest thing can be overwhelming, like going to the grocery store. Maybe you can offer to go with them. Maybe you can offer to put the groceries away. But there are a lot of things that are small. If it can be reading a story to somebody. It can be something, much greater in scale. But if, for instance, somebody is concerned about having to call FP&L, then maybe you can agree just to sit with them or be on the phone when they make that call, just so they know they have that extra support.
And
Support
also
is so
checking in.
important.
Sorry. Go ahead, Marsh. Go ahead, Sanj.
I just wanted to add a little bit, support is across the board extremely important, but it's also doing things like what we're doing today, learning more about mental health, learning more about the signs and the symptoms, so you can have that exchange with individuals and try to educate them and learn as much as you can, so you can talk about it and you can be comfortable talking about it, and sharing.
Another thought is one of the 10 tools for mental wellness is helping others, but giving somebody else the gift of helping you. So obviously, if somebody is in such a serious state that they can't get out of bed, that's a different story. But if somebody's just talking about how down and blue they feel, if you ask them to do something for you and allow them to help you, helping others is one of the tools for success.
And also taking that time to check in. Very often we neglect checking in on others. Just take that time to check in. Are you okay? Do you need anything? Is there anything I could do for you? Whether it be a phone call, a text, or you guys are Andy, technology Andy with the internet and with the Facebook and everything. Just that message. You never know what direction that message might go into. Someone here, you're thinking of them. That's very, very powerful. We tend to not do that. But one of the things that COVID has taught us how to do is to check in on each other and acknowledge each other. So we need to start doing that more often and start honoring that.
Excellent. Okay, another question. What can you suggest to people that aren't sure how to use a coping skill to calm themselves, or aren't always able to do so successfully?
One of the things that we could suggest is to reach out to a trusted adult. Some of you guys who are here and you're students, you're in school, reach out to your counselor. Say, hey, I'm trying to practice this and I don't know if I'm doing it right. Can you show me how to do it? Many schools now have mindfulness infused into their system as to help regulate and to deal with coping skills. So there are adults there just learning how to ask for help and not be afraid to ask for help.
And one of the most important coping skills is just breathing. And so when you're with someone, just breathe with me for a moment. Let's do it now.
Yeah, and if I can add a follow-up to that, this person was also asking if it's not successful, for example, if they're going through an anxiety attack and they're trying to calm themselves down, but nothing, it seems to be working. Well, what would you suggest at that point?
So I was wondering, Gail, at what point can somebody just call 211 and ask to speak to a counselor?
At any point. First off, if you're having that anxiety attack, find yourself a quiet corner, go ahead and make that call. We are really great at working through that. But keep in mind too, not every type of personal de-escalation, not every necessary personal trick works every time. So have that bunch of tools. Just like if a plumber comes to your house, they don't have just one tool in their bag, they have several tools. So you want to have several tools to make sure that in case that you're going through an anxiety attack or someone's going through an anxiety attack, they can pull one of those out. For some people, yes, breathing in a paper bag works. For some people, visualization or a minute meditation. Some people need to go outside, feel the sun on their face, feel some wind in their hair. But a lot of people, everyone may have something a little bit different that works for them. But if you're like, you know what, it's a little bit intense, it doesn't even have to be some great level of intense. You certainly don't have to be at a point where you're thinking about something, major. It can be, I just need to talk to somebody for a minute. Give us a call.
Gail, you
No
forgot the
one-
most important one,
which is
eating lots of chocolate.
That
Within
always helps.
Joel
and-
works for
and also-
Hershey's, I think.
And also, just if you have a buddy, if you have a friend, maybe that's something you can try. Just reach out to that friend that will always be there to pick up that phone or pick up that text or something. Just let somebody know what is going on, along with the ice cream and chocolate.
But seriously, there are a lot of preventive strategies and calming strategies that are available. And as Harleen said, Dr. Hutchinson said, they don't all work, or Gail said, they don't all work all the time. We find those that do tend to work for us, but you'll have our contact information. And I think probably every one of us has not only training and lists and tricks that we can provide on a more one-to-one basis to support some coping mechanisms and calming mechanisms that might be appropriate if the ones you're trying out aren't working well for you.
Perfect. I think that was a great way to end us up today. Just remember exactly, not one coping skill or one strategy. It's not one size fits all. Find what works for you. And sometimes it's not going to work 100% of the time, but you have to keep with it and you have to keep trying. And always remember to reach out for more help if you need it. If it's treatment, if it's a counselor, if the first step is just reaching out to a trusted adult in your life, wherever that may be, a teacher, a parent, an aunt, an uncle, a school counselor, there's a guidance counselor, there's many options. So just know that you're never alone and that there's a whole community of people who are there to help you. Yeah, and make sure to check in on your friends and on each other, and that's it. So it's now 8:33. I'm going to officially close this up for today. Thank you all so much for being here. It's amazing to still see so many of you on here today. I want to give a huge thanks again to all of our presenters today and to our co-chairs for their vision and leadership in bringing this event here to us today. Also, thank you so much to my coworkers, Jenna Stein and Angela Ventura, who's also my supervisor, for helping out behind the scenes. None of this would be possible without without all of you. So
Thank you, Corral. Great job.
thanks
Thank
all.
you, Carol. Thank you, guys.
Bye.
Thank
If you guys
you,
want,
guys.
Bye.
Thank you all so much.
we can take a quick group picture together if you want. But bye, everybody.
Bye.
Bye.
Bye-bye. Have a good
Have a
evening now.
wonderful evening and take care of yourselves.
Right.
Beautiful. Thank you.